fact that pharmaceutical products are being treated like ordinary trading commodities is what is responsible. We need better regulation. Price control has never been very effective in Nigeria. But if the profession was better regulated, we'll be able to cut out the level of people who profiteer from scarcity. I mean, just because a product has been scarce does not mean you should double and triple it, making profit at the expense of other people's health. And it gets to a point where sometimes the patients can't actually afford those products any longer, and you don't even know the number of lives that have been lost due to your own profiteering. It's so unprofessional. But if we had better regulation in the profession, I think we can reduce it to the minimum.
Okay, so what do you think is the cause of this regulation issue?
I think scarcity is a major cause, because there are a lot of people who have no conscience and they have a trader's mindset. You understand? If I get a product from a manufacturer or a manufacturer's representative, I ensure I store it well. You understand? Using good warehousing practice. When I'm distributing to my customers, I ensure I observe my GDP, good distribution practice procedures, and all that. But there are people who want to achieve the same thing at minimal cost. So everything required to ensure GWP and GDP, they're not investing in it. So the quality of the product they are delivering at the end of the day is not assured. That is, even if the product came from the right source. There are also a lot of people who are involved in faking and adulterating products. There are people who are so unethical that they are involved in redating expired products just because they don't want to bear the law. So there are a lot of sharp practices going on in the industry, and that is part of what NAFDAC is trying to eradicate by going to open shops in the market, evacuate these products and seal them up. It's a long task. I think the agencies are trying, and God will straighten them, but they still need to do more.
Okay, so what do you think they should do more?
Well, first, let's talk about the CWC, you know, the Central Wholesale Centers. Let's move all those in the open market to those coordinated wholesale centers that already have facilities built in to ensure the quality of the product. Next, let us man those CWCs, especially at the entrance, to be sure that products that are not authenticated and validated do not enter the CWC, and of course by that it will not enter into the mainstream.
Thank you very much, ma'am. What's your name again?
My name is Nike Abdulazeez, MD from Pharma Network. Thank you.